welcome to Healthy India. I'm Lottie Alaric. Well, folks, this is your own show wherein you get a lot of information about various health issues. We call here a set of experts who tell you as to how to recognize certain signs and symptoms of various diseases and how these can be treated. So in our effort to see you all healthy, in today's edition we will be talking about a weight loss surgery which is actually known as bariatric surgery. So to take this discussion forward, I have in the studio a distinguished panel of guests. It is my privilege to welcome Dr. Sandeep Agarwal, who's from the Department of Surgical Disciplines at AIIMS. Sitting to his right is Dr. Rajesh Khullar, who's a senior consultant at the Department of Minimal Access Surgery at Max Hospital. And to my right is Richa Jaiswal, who's a dietitian again at AIIMS. And to her right, we have a very important guest today. This is Harsh Panchi, who has undergone bariatric surgery and has benefited from this all. So I take this opportunity of welcoming all of you to the show. Well, folks, before we actually start talking to all our guests, let us all take a look at this report. Well, my team is trying for that report to come up. Well, before that happens, let me just quickly ask Dr. Sandeep as to if we were to define bariatric surgery in very simple terms, how would you do it?
Bariatric surgery is basically a means of reducing weight significantly. So it's a surgical procedure. It's a set of surgical procedures actually, basically 3, which aims at reducing your food intake.
Okay.
And it's not liposuction. It's basically you're not removing any fat. You're operating on the intestine and the stomach.
Right.
So as to reduce the intake of food. That is the basis of bariatric surgery. And at the end of it, you use a significant amount of weight is lost. Unlike other measures which are like dietary or exercise, with surgery and combination of diet and exercise, you lose a good amount of weight, 40 to 50 on an average in 1 year. So it's basically a surgery for weight loss.
So, Dr. Rajesh, who is an ideal candidate for whom you will perform this surgery? Is it any person for whom diet modifications or exercise programs do not work? Are they the ideal candidates for this kind of a surgery?
Yeah, you see, to decide who is the fit candidate for surgery, it is very important to have a set criteria.
Right.
And the criteria is the body mass index, we call it BMI. And every person at his home can calculate this BMI. BMI is calculated by dividing the weight of the person in kilogram, and you divide it by square of his height in meters.
Okay.
And you get a figure. And if the figure is up to 25, the weight is normal. From 25 to 30, we take it overweight. From 30 to 35, we take it obese. And above 35, we take it as morbid obesity.
Morbid obesity. Okay.
A person whose BMI is above 40, that is a candidate for bariatric surgery. Or a person who has BMI of 35 with 1 or 2 comorbidities like diabetes or hypertension or sleep apnea. All these conditions, they make the person's life more difficult to live.
True.
So they are to be operated at a lower BMI. This criteria has been given by WHO, but I would like to tell you that in Asia, this criteria has been lowered because it has been seen that in Asian population, the problems of obesity come at a little lower weight. So all these criteria have been lowered by 2.5 points in case of Asian population.
Okay.
So in Asian and Indian, normal BMI would be up to 23.5. And more than that will be overweight and then obesity.
All right.
That is the thing.
Well, we'll try and simplify that a little further for our viewers. So let us all take a look at this report through which you'll try and understand as to what bariatric surgery is all about.
Bariatric surgery, also known as weight loss surgery, refers to the various surgical procedures performed to treat obesity by modification of the gastrointestinal tract to reduce nutrient intake and or absorption. The term does not include procedures for surgical removal of body fat such as liposuction or abdominoplasty. For individuals who have been unable to achieve significant weight loss through diet modifications and exercise programs alone, bariatric surgery may help in attaining a more healthy body weight. There are a number of surgical options available to treat obesity, each with its advantages and pitfalls. In general, bariatric surgery is successful in producing often substantial weight loss, though one must consider operative risk, including mortality and side effects, before making the decision to pursue this treatment option. The two types of bariatric surgeries are restrictive and combined restrictive. The first surgical procedure simply reduces the size of the stomach using staples and/or a band, resulting in a drastic reduction in the quantity of food it can ingest. The second reduces stomach capacity and bypasses the upper part of the small intestine, causing a reduction in the number of calories and nutrients which the body absorbs. Usually, these procedures can be carried out safely. In all cases, surgery should be considered as a treatment option for patients who fails to carry out an adequate exercise and diet program with or without adjunctive drug therapy, and who have obesity-related conditions such as hypertension, impaired glucose tolerance, diabetes mellitus, hyperlipidemia, and obstructive sleep apnea. A doctor-patient discussion of surgical options should include the long-term side effects such as possible need for reoperation, gallbladder disease, and malabsorption.
Well, so we've just seen that that the doctors are definitely seeing very positive results as far as bariatric surgery is concerned. So let me bring in Richa now into the discussion. Richa, now as a dietitian, I'm sure you'll agree with me that these days everybody is a health freak, or a lot of us are health freaks, and people do try various measures of trying to lose that weight. So as a dietitian, how can a common person really know as to how long should a person keep trying, say, with these kind of modifications, and at what point can he or she decide that, okay, maybe it is time for surgery?
See, bariatric surgery, before going for a bariatric surgery, it's a complete package. Like even if somebody falls, is like a true candidate for bariatric surgery, they have to go for weight loss program by lifestyle changes. Because even after bariatric surgery, they have to follow the same. It's not a miracle. They will not lose weight within few days or something without doing serious, without taking this program as a serious package. They have to go maintain their weight by the help of surgery, weight loss, dietary pattern, and the physical activity. And the candidate whoever is like a true candidate, before surgery, 3, 4, 5, 6 serious attempts should be taken prior to surgery to check the compliance of the patient, because even after the surgery, lifelong they have to follow the same with little bit of modification.
True, true. And I'm sure under the guidance of an able dietitian.
Yeah.
Yes, okay. So Harsh, my obvious question to you would be that what was your weight like when you decided that, okay, this is the step that you need to take?
My weight was 103 kilograms before I decided to go for the surgery, and I didn't decide it myself.
Right, I'm sure.
In 2007, I had undergone another surgery for hernia and cholecystectomy. Then a surgeon only advised me to go to Dr. Sandeep Agarwal and to undergo this surgery, and talk to him. And he said, sister, this will really means change your life. Right. Then I went to him, talked to him, and then I decided to go for the surgery.
Okay. So, but before going for a surgery, were you also on a regular, a diet plan or say exercise programs and things like that?
Yeah, I had tried it many times, and on 1 or 2 occasions I lost 15 kilograms of weight also. Then again I had put up the same, and even I gained more weight in the due course of time. So losing weight without any help was really difficult.
So that was...
So then I decided to take this step, to undergo this surgery.
Okay. Now I think you were one of those fortunate people, I must say, that who actually was in consultation with a doctor who advised her for the same. But Dr. Sandeep, as a common person, somebody who is watching today, I mean, how long should they wait? The same question which I put to Richa is this, that how long should a person wait before he actually gives up that fight and before he actually comes and consults a surgeon?
Yeah, as one has to calculate their own BMI first.
Right.
That means if you are a body mass index 40 or above, that means you are at least 40 to 50 kg above your ideal weight.
Right.
An easy way to calculate is if your height is, let's say, 160 centimeter, you minus 100 from that, that's your ideal weight, roughly.
Right.
So you are 40 to 50 kg extra, you are a surgical candidate. One can give an attempt at weight loss, but it's like, if your artery is blocked, artery of the heart is blocked, 90% of it is blocked, how will any medicines work? So if the obesity is that severe that patient is unable to walk even 100 meters. So it's fruitless to carry out exercise and dietary regime for such a patient who is 40 to 50 kg extra, and one should probably consider surgery earlier than later.
That's
because
right.
what as Harsh said, that she gained more weight during the course of her dietary and exercise and lifestyle changes program. So one can actually, we have seen patients who have worsened. They have come for initial consultation, diffuse surgery or ran away from surgery, and they came back in a really bad state, and we had to optimize them before operating. So if one is really obese, I think surgery should be an early option rather than late.
Late, that's right.
So that's what I think we are of that opinion, that one should consider surgery early.
Right. Now, Dr. Rajesh, I'm sure there must be a lot many patients, if they are overweight, then the one thing that they would suffer of is diabetes.
Yes.
So in those cases, how successful is this bariatric surgery?
You see, one of the very important advantages of this surgery is that almost to the tune of 80 to 85% of these patients who suffer from diabetes along with obesity, the diabetes is almost cured. This is the first time in the history of medicine when we are talking about cure of diabetes.
That's right.
You must have heard that India is going to become a diabetic capital in 2020. The amount of the problems which the diabetes creates, and if we can do a surgical procedure by which diabetes can be cured, it will be a miracle. At present, we are doing surgery only in patients who have diabetes and are obese also.
Okay.
But the studies are already on, in which the studies are done in which even at the lower BMI or even overweight individuals with diabetes, and to see the effect of surgery on them, and the results are very encouraging and very positive. In almost 90% patients, the medicines are reduced. In about 80% of the patients, the diabetes is cured. And another very wonderful thing is that the requirement of drugs for diabetes, it immediately is alleviated. Immediately after surgery, within few days, even before the patient has lost weight, the diabetes is cured.
Oh.
That is the most important thing, and that is the best metabolic advantage which this surgery gives.
I'll just add here, Dr. Khullar, it's good that he mentioned that there are studies going on for use of this surgery for lesser obese people with diabetes, because we have seen 90 to almost 100% impact on diabetes. So one such study we have started at AIIMS, which has been approved by ethics committee, and we are very enthusiastic about, and we are awaiting the results of this surgery on lesser obese people. That means BMI of 30 to 35 with diabetes, who are on a lot of medicines and probably insulin. And we hope, like Harsh has, she was diabetic when she started. Her diabetes is gone. So we hope that surgery will soon come in a big way for even non-obese or even slightly overweight diabetics.
All right.
So I think that's really a very exciting thing we are awaiting.
I'm sure. Well, then any one of you who's obese over there, or maybe with morbid obesity, this is definitely good news for all of us. And surgery, this is a safe surgery. So if you're still in some doubt, I think this is the time for you to clear them, as I'll be opening the lines very soon. But Rita, now prior to a person who's going to undergo a surgery, is there a diet pattern that he or she has to follow before one goes into the surgery?
The target is like, as a dietitian has responsibility to give a few kgs of or few percentage of weight reduction prior to surgery.
Okay.
And it has been proved like prior to surgery, if patient reduce 5% of their present weight, that helps to reduce the liver size also, which helps in to perform the surgery and a better outcome after the surgery of a patient.
Okay.
So it's very important.
That's right. Well, there are people who can take care of that. So with the help of a dietitian and the right surgeons, you can definitely get rid of that weight that you've been carrying for so long. So do think about that while we'll slip into a break. But don't go away, as we'll be back in just a moment. Welcome back. This is Healthy India, and today we are trying to tell you all about bariatric surgery, which is commonly called weight loss surgery. So if you have any question regarding this, whether you have any doubts in your mind or any questions for the surgeons or for the dietitian and even for the person who has undergone this surgery, this is your time to ask those questions. So please pick up your phone and dial 1800115314 or 23035420. Just keep the volume of your TV set toned down so that we can hear you and you can hear us. So Harsh, I'll come back to you here. Now, when you decided that, okay, you are going to go for this surgery, so were there any fears in your mind at that time? Were you scared of just about anything, or was there any doubt in your mind then?
Actually, regarding myself, I was not afraid of this surgery because already I have undergone 3 surgeries, major surgeries prior to this.
Right.
So I never had any fear of undergoing this surgery.
No, but this was a little strange kind of a surgery. So did you believe that all that is going to happen, what the doctor was telling you?
Yeah. I had to believe him because I was I decided to undergo this surgery, and moreover I had seen the results of this surgery.
Okay.
Because they are conducting meetings with the patients who have undergone this surgery, and it's really we are able to see the patients who have undergone this surgery and have recovered. So after seeing them, I really got motivated, and then
Here
I
you
had
are.
no fear.
Right, and we can see that. Okay.
Because I am a health worker also.
Uh-huh.
I'm working at AIMS as nurse.
All right.
So I was not at all afraid. Layman, common people are actually afraid of with the name of surgery and undergoing surgery for themselves. It's really a big thing.
And did you ever believe that your diabetes could go away with this kind of a surgery?
Yeah, that's what he asked. He told me that your diabetes also will be cured, and that we'll have to watch afterwards. So the result was in front of me. After the surgery, I was taking oral hypoglycemics, and they were stopped, and then after some time, my asthmatic drugs also stopped.
So
my
for you
snoring
also
also
this must
stopped.
be nothing less than a miracle, right?
Yeah, it's really a literal change of life.
That's right. And I'm sure all those people who are watching, they must be gathering what we are gathering
My
here
life has
today.
entirely changed.
That's right. Okay. Well, right now we are joined by Narendra from Hyderabad. So Narendra, if you're there with me, welcome to Healthy India.
Yes, I'm there. I
Yeah.
would have asked this from my mother,
Okay.
who is about 50 years,
Uh-huh.
and she's not a diabetic, but she's overweight. She's about 5.2 in height and having a weight of 79 kgs.
Okay.
And she's having a problem of incisional hernia,
All right.
which she's supposed to get operated. Is it possible to get operated bariatric surgery simultaneously? I want to know the doctor.
Okay. Thank you very much for that question. Dr. Sandeep, I'd like you to answer that
Yeah,
question.
if I understood him clearly, the height is 5'2",
5'2".
weight is 79
Right.
with incisional hernia.
Right.
So as I said, if you convert 5'2", is about 156 centimeters of height. So your ideal weight should be around 55 or 56. So you're only 23 kg overweight. So definitely, I think you're not a candidate for bariatric surgery unless you have other comorbidities like severe diabetes or sleep apnea. Then maybe. But at this only 23 kg, I think the risks of surgery do not justify surgery for you for bariatric, for reducing weight. Because 23 kg within a good program of diet and exercise, one can, even if you reduce 15 kg, 16 kg, that'll be good enough. Even if you consider bariatric surgery, it's our policy not to combine 2 surgeries most of the times, because then it creates problems for the patient and the doctor sometimes. So we advise normally in a real candidate, as you know, if a person has really 40 to 50 kg extra with hernia, we'll say go in for bariatric surgery first, lose 25, 30 kg in let's say 6 months, that's the average time one loses about this much of weight, and then go in for the incisional hernia surgery. Unless the hernia is very small, which can be fixed at the same time. But most of the times hernias are really medium or big sized, which need the mesh which is, a foreign body. So we don't want to put the mesh at the time of bariatric surgery, and we'll wait for the weight loss to occur. And that also means that patient won't have a recurrent hernia. If patient is obese and you repair the hernia, it's a highly likelihood of, patient having a recurrence of hernia. So for him, definitely surgery is not indicated for weight loss.
So Narendra, for your mother, she only needs to have those lifestyle modifications, and I think that should be enough. That's what the doctors here feel. Well, right now we are joined by Meenakshi from Delhi. So Meenakshi, if you're there with me, welcome to the show.
Yeah, thank you.
Please go ahead, Meenakshi.
ओके एक्चुअली मुझे ये पूछना है दैट मेरा जो वेट है वो 105 केजीज है और मेरे जो एज है वो 28 इयर्स है और मैं ऑलरेडी लिपोसक्शन एक बार करवा चुकी हूँ.
और आपकी हाइट क्या है मीनाक्षी?
हाइट है 5.4 इंचेस.
ओके.
हाँ जी, तो मैं ये पूछना चाहती हूँ क्या ये सर्जरी मेरे लिए ठीक होगी क्योंकि मुझे पीसीओडी की भी प्रॉब्लम है.
ओके ओके. सो आपको लाइपोसक्शन से कोई फर्क नहीं पड़ा इसका मतलब?
हाँ, उससे कोई फर्क नहीं पड़ा मुझे. बस एक बार वो वहाँ से स्पॉट रिडक्शन हुआ था, थोड़ा सा इंच लॉस हुआ था, लेकिन वो फिर से वैसा ही हो गया.
Right. Well, liposuction, if I'm not wrong, is just a cosmetic procedure, right?
Yes.
Well, so as a doctor, what would you advise her?
Yeah, I think she is a good candidate for bariatric surgery because if her weight is 105 kg with height of 5.4, her BMI would be more than 40 if we calculate her BMI.
Right.
And at that weight, it is important for one to understand that it will be very difficult for her to reduce her weight by diet and exercise. And liposuction is only a cosmetic and it's a contouring procedure.
Right.
You cannot lose weight by liposuction. And she'll be definitely benefited by this surgery.
Right.
Definitely.
Okay. So, Dr. Rajesh, also in addition, can you just tell us as to what are the categories of this kind of surgery? Are there any types of surgeries that you undertake?
Yeah, you see there are three procedures which are at present available to us. First procedure is, which was shown in the video also, it's a band in which we put a celastic band, and let me tell you, all these surgeries are done by laparoscopic technique and the patients are able to walk the same day evening after the surgery. And in band we put a celastic ring near the food pipe by making a small pouch of the stomach so that the active stomach becomes small and a person can eat only small quantity at a time. We can adjust the opening of this band. We can reduce or increase the opening. That is the band. The second procedure we call is a gastric sleeve, in which we remove about 60 to 70% of the stomach. Stomach is the bag in which the food goes when we eat first. By reducing the size of the stomach, the amount of food which a person can take is reduced. By this, the calorie intake reduces, and this is how the person tends to lose weight. The third procedure is a Roux-en-Y gastric bypass, in which we again make a small pouch of the stomach, which may be about 30 to 50 ml, and we bypass the initial part of the stomach and initial part of the small intestine, and anastomose join part of the intestine to the newly formed stomach, so that if a person eats certain amount, that food does not come in contact with the enzymes which are produced in the stomach. So part of the food which has been taken, that does not get absorbed.
Right.
So this procedure is restrictive, means the person eats less, as well as little bit of malabsorption, that everything is not absorbed. So this bypass gives a very good result in the long term in reducing as well as maintaining the weight of the person.
That's right. I think that's very well explained by the doctor. So now we are joined by Joy from West Bengal. So Joy, if you're there with me, what is your question? Yeah, Joy, can you hear me please?
Hello.
Yeah, please go ahead, Joy.
मेरा क्वेश्चन है, मेरा जो उम्र के हिसाब से मेरा एज है 33 प्लस, तो मेरा जो वेट है 75, ये एक्चुअल है क्या? ये क्वेश्चन है.
आपका अपना हाइट बताइए पहले.
हाइट है 5 feet 8 inch.
5 feet 8 inches. Okay, well, let me direct towards towards Dr. Sandeep.
Again, if I get it right, 5'8", with a weight of 70 kg.
That's what
79.
79, if I'm not mistaken.
You're just a little bit of overweight. That's all. You just need to maybe modify your lifestyle, eat a bit less especially sweets.
And do some exercise.
Do some exercise, 1 hour at least every day, and you are going to be fit. No need to even think of surgery.
That's right. Well, you probably have to keep the laziness away and actually start working on yourselves probably. Well, now Richa, he just told us about these kind of surgeries. So is the diet any different after a person undergoes one surgery than the other, or is it the same kind of a diet that a person would follow?
As a dietitian, I categorize all three differently. Like if somebody goes for gastric band, their patient need very strict and disciplined life, because gastric band is like a band, no surgical procedure has been done for the patient.
Right.
So if somebody is not disciplined while picking up things and eating and maintaining their improving their lifestyle, and then the person is person can put on weight easily and may not get the result for what he might have gone under some procedure. So very disciplined, very a person can understand the total program and package in a well manner, person should opt that kind of surgery. And more frequent visits are required in initial days, where as a dietitian, I advise them not to go for liquids which has very calorie dense. A small quantity liquids which is less calorie or non-caloric liquids are always advisable to all kind of bariatric surgery patient who has gone under bariatric surgery. But calorie dense liquids are really prohibited for the patient, because they can drink it easily and they can consume the same amount of calorie or maybe extra calorie in that way. Person who goes under sleeve, as a dietitian, I find it little I can be little relaxed, because person can't eat extra.
Okay.
So if they try to eat extra, they will puke it out, or maybe some because of discomfort or something they may not.
They won't eat it in the first place, right?
The main concern is like to plan diet according to their acceptance, and in a small quantity. How their fight is not to advise. Their fight is to advise what to advise them to provide a good amount of calorie for maintenance and good amount of protein and micronutrients.
Right.
In a gastric bypass, again the fight is to plan a very good diet for the patient, because as sir mentioned, that is a malabsorptive procedure too. So their macro and micronutrients, all nutrients are very important, and small, pore size is very small. So in a small quantity you have to give a good amount of nutrient.
So which actually means that one should just follow the dietitian, I think, blindly, otherwise one could actually mess it up. Well, it's time for us to slip into another break, but do come back quickly, as now we'll be talking about the risks, if there are any, involved in bariatric surgery. We'll be back in just a moment. Welcome back. This is Healthy India, and today we are telling you all about bariatric surgery, commonly known as weight loss surgery. But let me tell you, it is only meant for people who have morbid obesity, and not for anyone who's maybe just weight maybe just about 4 to 5 kgs or maybe 10 kgs above normal. So do keep that in mind. Well, you can still call us. Our doctors are here, our panelists are here, and the numbers are the same, which are 1800115314 and 23035420. Having said that, we are joined by Neeta from Haryana. So Neeta, if you are there with me, welcome to the show.
Hi, this is Neeta. My weight is 96 kilos.
Okay.
Actually, before my delivery, my weight was 55 and my height is 5.3. Or after delivery, I am suffering from too many diseases. One is hypertension, another is endometriosis,
okay,
and third one is uric acid, and thyroid.
All right.
And day by day, my weight is increasing. My diet is not, I can't say much. It's 2 full carbs in a day.
Okay, so which means you're actually on a lot of medications, right?
Yeah, a little bit. I can't say that.
Okay, and now you want to ask whether you are a candidate for bariatric surgery.
Yeah.
All right. Well, let's turn the question towards Dr. Rajesh.
You see, if your weight is around 93 kg and you are 5'3", with problems of endometriosis and hypertension, I think you will come in the category in which we have her BMI more than 35 along with comorbidities. And I think she will be definitely benefited by the surgery. By doing surgery, her problems of hypertension, her problem of other problem which she has, they will be definitely taken care of. And the effect will be very quick, because the weight loss required in her case is not much. Even if she loses after surgery 20 kg, she will be almost normal. So it is very important to understand this. And in trying to lose weight at this stage, she will gain another 10 kg in next 6 months. So that will add up to her problems further.
True.
So I think she'll be definitely benefited by the surgery.
Right. So Neeta, I must say that you are one of those fortunate candidates for whom the doctors have diagnosed your condition right here on the television show, and probably what you need to do is go and consult the right surgeon, and we wish you all the luck. Now, Dr. Sandeep, I'd like to come back to you here. Now, since we are talking about these 3 kinds of various surgeries, now who makes that choice for this surgery? Is it the patient himself, or is it the doctor who will actually advise the kind of surgery that one must opt for?
I think it's a very good question. When the patient comes to us, we have a detailed counseling. It's almost like a 30 to 40 minute discussion with the patient, starting with her problems, and then we discuss the surgical options. As Dr. Khullar has said, there are 3 surgical options: gastric banding, sleeve gastrectomy, and the gastric bypass. So each procedure has its own benefits and disadvantages. Now, if you talk broadly, if the patient is really obese, like BMI 40 or more than 50, and the patient is fond of eating, they can't restrict themselves, we'll not advise banding for them. We'll go in for procedures like sleeve gastrectomy, where, as I said, 70 to 80% of stomach is removed. The patient's hunger goes. There's a hormone which is secreted by that portion of stomach which is removed. So that the hormone is taken away. The patient doesn't feel hungry, and weight loss is almost in an auto mode after surgery. As Richa also said, you're not really worried about too much about diet. You have to prescribe a particular diet, but since the patient is not able to eat too much, they keep losing weight. And same thing happens with gastric bypass. That they lose a good amount of weight, their hunger goes away, and both of these procedures impact diabetes very, very favorably. Now, if a patient is, let's say, 100 kg with a BMI of 38, has tried multiple attempts at weight loss, is a young girl, planning to get married, and so for her, even a 25 to 30 kg weight loss will be good. So, and she understands the mechanism. She knows that she has to restrict herself, stop after eating a certain amount, because their hunger doesn't go away. They have to discipline themselves to eat that much. For them, banding is a good procedure. Why? Because, one, it's extremely safe. It's the safest bariatric procedure. The other thing is the patient can go home the next day, and the weight loss can be modulated according to the need of the patient. The band is adjustable. You can put in, after 3 or 4 months of surgery, you can put a few ml of saline in the office and tighten the band, and patient can lose further weight. But having said that, I would still say band is actually suitable only for limited number of our patients. Most of our patients, like most of our Indian population, want to eat parathas, and volume of food is they're volume eaters. So once it comes to volume eaters, I think band is not a good procedure, and then sleeve and bypass, also it depends on a bit of surgeon's experience and what he's comfortable with.
That's right.
So at AIIMS, as we prefer sleeve gastrectomy quite a lot, and although we have been doing a lot of bypasses, but we have seen equally good results with sleeve, and the risks of sleeve are lesser than bypass. The nutritional problems of bypass are more. In long term, vitamins, minerals, the cost also adds. Not only the patient has to take them, the cost also adds. So we have to consider all those factors when you are deciding those procedures. So broadly, the most popular procedure in our setting is a sleeve, followed by a bypass, and in a suitable patient who understands, who is educated, who is motivated, will do a band.
Right. Well, right now we are joined by Vinod from Uttar Pradesh. So Vinod, if you are there with me, welcome to the show. Vinod, are you there? Well, we seem to have lost Vinod for the moment. Now, coming to you, Dr. Rajesh, now I specifically want to talk about the surgery in which you remove a part of the stomach. Yeah. So are there any risks involved in this kind of a surgery? Because the banding sounds pretty simple, though, of course, I'm not the person who can say that.
Yeah. You see, the banding, you're not cutting or uniting anything. You're just putting a scholastic ring around the stomach. Whereas in sleeve gastrectomy, we are actually cutting the part of the stomach. And this cutting and suturing is done by the automatic available staplers.
Okay.
We don't have to really suture them, but we have automatic staplers which provide 3 layers of staples on either side and then cuts in between. Now that it gives a good safe cutting and suturing through which the leakage chances are very little. but ultimately the healing occurs by patient's own mechanism. And rarely, maybe in less than 1% of case, there may be slight leakage from where you have cut. But I think that can be managed by different medicines and techniques.
All right. Now, Harsh, how did you prepare yourself, especially as to after the surgery? Because I'm sure a lot of discipline must have been required, whether it was in your lifestyle modifications or in your eating habits. So how did that really work for you?
After undergoing surgery, on the same day, doctors made me to walk.
Okay.
And whenever they used to come to the ward for rounds, sister, you have to keep on walking. Initially, it is slightly difficult.
You must
because
have
of
thought that they
pain,
are stricter
etc.
with me because I'm a nurse here. Did you ever think that?
No.
All right. Okay.
Sometimes there may be that, sister, you are in this field and you can understand us in a better way. And that Madam Rita used to scold me quite a lot time because of that sometimes diet here and there. And then he used to tell me, sister, then you will come with anemia, you are not taking properly, then you don't come to me. That she was doing, it was for better of me.
True.
So I never minded that. I took it in a positive way and I tried to improve. And following diet pattern, it was not difficult. Sometimes you feel like eating, others are eating, so I also feel like eating, but then it's okay.
Right. Well, this prompts me to ask Richard, so if there are, now this was one disciplined patient or almost disciplined patient we can say, but for some of the others who may, cheat sometimes on their diet patterns, so then what are the complications that these people can fall into?
Definitely, they come with, again, they put on weight and they come with extra weight, but with this, I said initially that this is a complete package. A patient can't get rid of without getting weight loss.
That's right.
So they have to visit us frequently, either with the doctor or with the dietitian. So on a frequent visit, it's not they come back with 10 or 20 kg of extra weight. They come with 1 or 2 kg of extra weight. Whether they come to visit to dietitian or the doctor, they keep they keep a check on their weight and they send dietitian again to check their dietary pattern and modification if required, and little bit of weight if somebody has put on 1 or 2 kg, that can be manageable again.
All right. Okay. Now, Dr. Sandeep, I'm sure counseling plays a very important role in these kind of surgeries, pre-surgery as well as post-surgery, I'm sure. So, so what is it that, how do you talk to your patients and how do you encourage them first to go for this surgery?
Yeah, that's again, when we started bariatric surgery, we really had to spend time motivating the patient to look at the good effects of surgery.
True.
Now what is happening is most of the patients have seen the results around them. A patient who has lost 50 kg is a walking advertisement for the bariatric surgery. Everybody asks them what happened, how did you lose weight. So most of them, when they come to us, they have already decided on the surgery. What they don't know that what is the surgery, what are the benefits, how much time will it take to lose weight. Some of them think they will come out of the operation theater in like a
totally like a model.
So that doesn't happen. So as I said, counseling is a very serious affair.
Right.
We make them aware that bariatric surgery is not like a pill you swallow and you get all right. It's a very serious business. We always insist that they get a near relative or a spouse to understand everything, because there are certain risks involved, as Dr. Khullar said, and we want them to understand everything before we told them there's no hurry. Go back to the net. We'll give them some educational material. We have pamphlets on each surgeries. We not only explain to them when they're being counseled, they're given the material which they read at home, and there is another counseling session just before the surgery. They again ask those questions. That is one aspect. Secondly, they have to undergo detailed investigations. We have to ensure that they are fit for surgery. This is not an emergency surgery. They have diabetes, sleep apnea, blood pressure. So all those things need optimization, correction before surgery. So they're sent to different specialists. And after they have done everything, they come back. We encourage them to ask a lot of questions. We say, okay, what do you want to know? What else do you want to know? And especially, I want to be very clear that they should know that bariatric surgery has certain risks, very low, less than 1%, but not zero.
Not zero.
Including risk of mortality sometimes.
I guess that most of the surgeries would have that much of a risk.
Yeah,
right?
but in this surgery, because it's not a must-do surgery, It's not a must do surgery like a tumor or this thing. They must understand that
right.
before undertaking.
Well, and have you ever seen after all those counseling sessions, somebody has developed cold feet at the last moment and said, okay, I don't want it?
Yes, definitely. I think this used to happen very early in our experience when we used to motivate them. But to, obviously, even I would be scared of surgery if I have to undergo surgery. So what we do is, these patients are given the numbers of other patients who have undergone surgery, who have been willing to, share their experience.
And I think we have a very fine example.
And then Harsh said we hold patient support group meetings. She attended. What we do is regular intervals, we hold these meetings.
I'll have to interrupt you for a moment because we have to slip into this break, but people do come back quickly as there's still something more on the other side. Welcome back. This is Healthy India, and today we are talking about bariatric surgery, commonly known as weight loss surgery. Well, now at this point, I would like to ask you, Dr. Rajesh, we are talking about certain risks, but is there a very serious complication that you can face in a patient who's undergone surgery?
Yes, really in some patient you can have, as I said, that's a little bit leakage because you are cutting and suturing and with a stapler. But ultimately healing occurs by the patient's own mechanism.
Right.
And there is variation in every person. No two people are alike. And if somebody's healing power is little less, there may be a leakage from that cut line. But in most of the situations that can be taken care of by medicines and by keeping the patient ill orally. So we have to see the risk versus benefit ratio. And if you see the benefits of weight loss surgery, they definitely overcome the risk which are involved in this surgery. But yes, there is a definite risk involved in these cases. Yes.
Right. Now, Richa, are there any stages of this diet pattern that you advise your patients, or it could be just about for any other surgery?
No. It's like the diet progression is different. Like immediate after surgery, a diet would be a very clear liquid diet where we advise an almost non-caloric, means very less calorie patient get out of it, but that is just for a day. Like all coconut water or lime water, juice, tea, coffee, something. And we see the patient acceptance and improvement if patient doesn't complain about the distension or anything, any other complication. Then the very next day we can put patient on a full liquid diet, but then again quantity is very fixed because his stomach size is small, so patient should understand that part, that newly created stomach size is small, so quantity would be definitely less. And then the progression, we have to go with the surgeon. So how strictly how tight sleeve or other procedure surgeon might have done. So quantity and the time period we fix according to that. Sometimes it would be a 2 weeks or 3 weeks or maybe a month liquid diet and then to puree. Sometimes it would be little lesser according to type of the surgery, and after that patient would be on a semi-solid diet and then to a normal diet.
Okay.
So entire period to coming to a normal diet, it would be from a month to a 3 months. That depends on the type of procedure
and also the procedure. Right. Now, Harsh, how difficult or how easy was it for you to follow these kind of diet patterns that Richa has just been talking about?
It's really not easy to follow.
Right, and for someone who loves food, because I'm sure this kind of a problem mainly occurs with people who are foodies.
That thing is also there, but in initial stage, after surgery, even taking liquids is also difficult. Stomach is cut and sutured.
Right.
Ingesting even liquid is also difficult. With a period of time, when the time increases, it is okay. Slowly. It takes around 2 to 3 months, like she said, to come to a chapati.
Okay.
Initially 2-3 bites, then half chapati, then one chapati at a time. It takes time, but it is good.
I'm sure. Of course, when you see the results, then everything is good. Right. Now, Dr. Sandeep, I'm sure in bariatric surgery, the follow-up procedure is as important as the surgery itself. So what is the frequency of this follow-up treatment, and what should a person expect, a person who has undergone this surgery?
The follow-up, as said, is almost lifelong.
Yeah.
But we start with, let's say, we see the patient 1 week after the discharge to see if they have any problems, especially wound related or any difficulty in swallowing fluids, or if they have any complications, early signs of complications. Then after that, we call the patient at 1 month to check on their weight, are they progressing well. Then 3 months, 6 months, 9 months, 12 months, and then 6 monthly for a few years. Now what the patient should expect is a weight loss of about a kg a week. So about 4 to 5
That's the
kg.
average.
And it's initially faster. Some we have seen patients losing about 20 kgs in first 3 months, about 35 kg in 6 months, and 45 kg. That's our mean. We have analyzed the results. That's the mean, about 45 kg in 1 year. So they should be progressing at this rate for most of the sleeve and bypass. For band, it's a bit different. The follow-up is a bit stricter because band patients can totally, fail. They may fail to have any amount of weight loss. They may lose weight of 3 to 4 kg in initial months, and then they stabilize. And if they don't come, then we have not got the optimal results. So the band patient needs to be followed almost monthly for the first year because we need to have a look at the weight loss. If it is less than 4 kg, 3 to 4 kg a month, then we have to adjust the band by putting in some saline in the chamber. So and tighten the band. So it's fairly strict, and we keep a tab. If the patient doesn't turn up, we call them up.
Oh, now that's fantastic. Okay, now Dr. Rajesh, does age have any significance in bariatric surgery? Because these days we even find children who are obese or even have morbid obesity. So is there an age in terms of a child, and also if somebody is, say, of a certain age, that you will not hold the surgery for them?
Yeah, that's a very important question, because we have one of the problem which India is also facing is a childhood obesity. We are finding more and more obese children in school.
Right.
And let me tell you, obese child will become an obese adult. So we have to check the obesity at the childhood. But as far as the weight loss surgery is concerned, I think the person has to be adult. So we keep the age at 18 years minimum at which the surgery is done. But in certain special cases, if the individual has attained maturity, the biological maturity, even if he is 16 years and he has attained biological maturity, and if his BMI is around 50, I think there is no point in waiting for 2 years and then operating. We should get benefit of surgery to them. Same way, if a person at the age of 60 is otherwise healthy, I think there is no reason why we should not give the advantage of weight loss surgery to them. Important thing is in these cases that we prefer to do sleeve in these cases which is less morbidity. So extreme of ages, sleeve is a better procedure for these patients.
Right. Well, I do hope people that we've been able to clear a lot of myths, a lot of doubts in your minds regarding bariatric surgery. But in case some of you have missed out on the large part of discussion today, take a look at these graphics through which we'll tell you as to what all we have talked about. Here's a recap.
If a body mass index or BMI of 40 or more, a BMI between 35 and 39.9, and a serious obesity-related health problem. Diet stages. Stage 1, clear liquids. Start about 1 day after surgery. Stage 2, semi-liquid diet. Start about 2 days after surgery. Stage 3, semi-solid diet. Start when directed by your doctor, usually 3 to 4 weeks after surgery. Stage 4, low-fat solid diet. Start when directed by your doctor. Points to remember. Bariatric procedures are serious operations with the risk of significant complications. Many gastric surgeries are irreversible. Patients should thoroughly discuss all their options with their doctor. Patients must have realistic and informed expectations about the impact of surgery. After surgery, it is vital to adhere strictly to proper dietary and exercise guidelines. Participation in post-operative support groups is beneficial for many patients.
Well, so those were the final points as far as bariatric and what more you would like to see on this show, because I keep waiting for your mails as they mean a lot to me as well as to my team. So keep writing into me on this address.
Healthy India, FB 116, Lok Sabha Television, Parliament Library Building, Parliament House, New Delhi 110001. Email healthlstv@gmail.com. And our toll-free number is 1800 115314.
Well, so that feedback is important, so keep sending in all your mails. Well, let me say thank you to both of you doctors for coming today and clearing so many doubts and making it sound so very simple, which I'm sure it is. And thank you, Richa, for coming in and giving us all those finer points. And my special thanks to you, Harsh, for being here as an example. And I'm sure you will, I'm sure you're a source of encouragement to many people out there. So, well, people, this is all we have for you today regarding bariatric surgery. But there are a few things that you need to keep in mind, and that is, if you are overweight to an extent that you cannot manage it with your lifestyle modifications or your exercise programs and diet programs, then this is the surgery that is meant for you. And the risk, as the doctors here have said, is only 1%, but the benefits are immense. So this is one surgery that you can opt for with the right counseling in the hands of the right surgeon. You can absolutely benefit just like Harsh has done here. So that's all we have for you. I'll see you next week with another engaging discussion. Till then, this is Lottie Alaric saying goodbye and take very good care of yourselves.